Hi everyone, this is Dr. Merhaut with Elite Sports and Spine Chiropractic. Welcome to this week's Elite Education Series. I'm here with Dr. Keklak and his foot. A little bit sunburned, but it'll work for today. So what we're going to be talking about is just feet in general and kind of how just problems within the foot themselves can cause problems all the way up the line, even all the way up to the head. So we're going to talk a little bit first about the arch of the foot and kind of how that's important. Why it's important to have arch support if you don't have an arch that's of normal height. So that means it's a dropped arch. We call that pronation of the foot. So with that, if the foot kind of caves in, the arch through here pronates. So that means it's considered like a flat foot. A lot of people say, "Oh yeah, I have flat feet." So with that happening, that's kind of the start of what a lot of people will develop a bunion. Flat feet or a dropped arch is kind of the starting point of the formation of a bunion. And the reason for that is if you have the arch here and that arch is dropped, so the foot goes like this inward, then as you're standing, the toes right here, the joints of those toes get pushed over this way. So basically what that bunion is the bone here and the bone here are being kind of separated or forced into an angle because of the one arch dropping and then the toes going this way, and so then therefore the bunion forms. Oftentimes people get pain with the bunion because of the shoes. It's more common in females compared to males. My personal opinion is because females typically will wear more different types of shoes than males. They also wear high heels typically more than males do. So with the high heels, that kind of pushes the toes inward because of the narrow toe box, as well as usually heels don't have arch support. And then also if you're wearing multiple different shoes, whether it's sandals, flip-flops, and then whatever other types of shoes, you're constantly changing the support of the arch of the foot. Whereas on the contrast, this is just typical, but males don't usually wear multiple different types of shoes. They're sticking with the same type of shoes. That's just what I see typically day to day in the office. So if you're wearing the same type of shoe constantly with the same amount of support with it constantly, then it's going to be providing that, and therefore you're less prone to getting the bunion formation. That's not saying that males don't come in with bunions, but we typically see, and the research shows that females are more likely to get the bunion. So with that, again, with the arch, if we have flat feet or the arch is dropping, or you don't wear a supportive shoe that supports the arch itself, or the bottom of the foot, the intrinsic muscles of the bottom of the foot aren't strong to support the arch, then that, like I said, it's dropping the arch. And then we have a couple muscles up here. We have the tibialis posterior as well as the flexor hallucis longus. Those both come down through this area and attach at the bottom of the foot. Some people come in, they complain about pain at the heel. So they say, "Oh, I have shin splints," or they have plantar fasciitis. So if they have the heel pain, they consider it, plantar fasciitis. A lot of times I see it misdiagnosed, where it's actually not plantar fasciitis. It's actually a problem with the tibialis posterior muscle up here, or the flexor hallucis longus muscle that come down and attach to the bottom of the foot, and they're having pain along the line of where that muscle or that tendon is. So simply what I'll do is I'll do a simple muscle release to this area. This happens all the time where I do a muscle release up here. They don't really notice that it's painful until I start pressing on it. They say, "Why are you treating up here when all the pain is down on the bottom of the foot?" And then the next time they come in, they're like, "I don't know what you did, but I no longer have the heel pain. It's because I treated everything up here where the actual problem was." So that's something we see, where those muscles that come down, they're also supporters of the arch. So if the arch is fallen, then these guys have to work a little extra hard to support that, and that's when you start developing that pain on the bottom of the foot, or people say heel pain. Now you can develop plantar fasciitis due to a low arch as well, so that's another problem that can occur, but it's just a matter of diagnosing it correctly and then treating it correctly. So sometimes it's misdiagnosed and we treat another area and then the heel pain goes away, or if it is plantar fasciitis, we can treat that as well with different things. One thing I do want to show you, we have a picture that's in one of our treatment rooms. It's actually a foot leveler's picture that is the company that we use for orthotic scan. So I'm going to show you the picture. It's going to show you how an arch will drop on the foot right here. So if we have an arch drop on one side, that has an effect all the way up the line. So you can see that the knee rotates in. So if you have a bad arch or problems with the foot itself, you can have knee pain, you can have hip pain, you can have low back pain, you can have shoulder pain, all the way up to even headaches. So worst case scenario, I've seen it just a select couple times where we get someone a pair of orthotics, and the headaches that they've been having that we weren't treating, they said, I no longer have headaches because now I'm wearing the orthotics in my shoes. So if you think that, foot pain, you've had an ankle injury, you sprained your ankle, you have flat feet, and that was never really addressed, but you have knee pain, hip pain, low back pain, even shoulder and neck pain or headaches, maybe it's something to check out to see, is this the initial problem that is causing everything else up the line to be painful? So we often look at that. Oftentimes if someone comes in with back pain, hip pain, knee pain, I'll immediately look at the feet, and we may do an orthotic scan to see what's going on down here, or what's the history. Did they have surgery down here at one point? Did they sprain their ankle at one point? And that causes a dysfunction down here that gradually leads to other problems up the line. So that's definitely something we're looking for. So if you think that potentially your foot is causing some of your pain, or if you want us to check it out to see if your foot is causing other symptoms up the line, feel free to comment on the post. If you think that someone will benefit from the information in this video, feel free to share it with them. This is the Elite Education Series. I'm Dr. Merhaut here with Dr. Keklak and his foot, and we'll join you. Hope you join us again next week for next week's video. Thanks.